You have probably heard the saying, water is life, and clean water means health. Access to safe and clean water is a human right recognized by the United Nations, obligating countries to ensure water and sanitation for all without discrimination. This includes ensuring that water is available, accessible, affordable, and safe for human consumption. Data from the Uganda Bureau of Statistics shows that while many Ugandans now have access to improved water sources, contamination remains a major concern.
So as you can see, in the urban area, there was 89% of population of households who are using improved water. Then in the rural area, there was 78%, those who are using improved water. And as you can see, that there is safety managed drinking water. In the urban area, there is 31%, and the rural area, 8%. Then those who are using at least basic, in the urban area, there is, it was 76% and 55% in the rural area. Percentage of households using improved source of drinking water, 84.9% of the refugees households use improved source of drinking water. Then 77% of the households, of the host communities' households, they use improved source of drinking water. Then 81.7% in Uganda, they use improved source of drinking water.
Despite its critical role in survival, many Ugandans are still denied full enjoyment of their right to safe water. According to the 2022 Uganda Demographic and Health Survey, nearly 90% of households are using contaminated water.
The percentage of households whose drinking water is contaminated with E. coli. E. coli, here we are looking at the water which is contaminated with feces, some materials, cow dung. So as you can see, Teso region is the highest with 98%, 98.3%, followed by Acholi, followed by Lango.
The Commissioner for Water Quality at the Ministry of Water and Environment, Lilian Idrakwa, says the ministry has not yet conducted a new national survey to compare these findings, but adds that the situation is unlikely to have improved significantly. The Commissioner for Water Resources Planning and Regulation, Dr. Kalist Tindimugaya, says that water contamination comes from various sources.
Number one, a source could be contaminated by poor sanitation practices. In many of the areas, people are getting shallow groundwater or water from springs. And in many cases, some of the springs are actually located around pit latrines or homesteads. So when people are consuming that water that is shallow, in many areas where we have shallow groundwater, if they don't boil the water, then the water will be contaminated and they will have challenges with the diseases.
He says that even where water sources are safe, contamination often occurs during collection, handling, storage, and use at household level.
Many people don't wash their utensils, maybe the cups, maybe the buckets where they put the water. Some of the people even go to the toilets and they don't wash their hands. So it's a combination of those issues. And of course, as a ministry, we are concerned about that.
As part of efforts to promote safe water consumption, the ministry has banned the use of shallow wells and is now encouraging communities to rely on deeper underground water sources.
Where we are now drilling boreholes or even existing boreholes, we are pumping the water and distributing to the people. Right now, we are motorizing boreholes using solar so that we can have people access the water that is safe.
The ministry is also pushing for improved sanitation facilities, especially in areas with low water tables, to reduce contamination risks. Officials say increasing public awareness about how water gets contaminated is key to reversing the trend. Meanwhile, experts advise households to take simple steps to ensure water safety, including hand washing, boiling drinking water, using water filters, and water treatment. With countries around the world racing to achieve Sustainable Development Goal 6, which aims at ensuring safe and sustainable water and sanitation for all by 2030, we asked the ministry about Uganda's chances of meeting the target.
We have 6 targets. So under those 6 targets, we have different indicators, and all of them were behind the schedule. We are not able to meet any for a number of reasons. Number one is, of course, the resources we have are limited. Because we are talking about bringing water to people's compounds, safe water, safely managed sanitation services, safely managed water services, but also ensuring good quality. So we are behind the schedule. We are not going to meet these targets, but we are trying our best, and that's why we need to scale up. We need more resources, financial resources. We need to build the capacity of the people who are doing work at different levels so that we can achieve this. But also, water and environment are related. If we don't protect the environment, then you don't protect the water.
I'm Benjamin Jumbe, NTV Weekend Edition.